Zombie drug is a term used to refer to a type of synthetic drug that can cause individuals to exhibit behavior that resembles that of a zombie. These drugs are typically referred to as bath salts or flocka and are chemically similar to cathinones, a stimulant found in the khat plant. When individuals use zombie drugs, they may experience a range of symptoms, including hallucinations, paranoia, delusions, and extreme agitation. They may also exhibit violent and unpredictable behavior, and in some cases, they may become catatonic or zombified. It is important to note that the term zombie drug is not a medical or scientific term, but rather a sensationalistic term used by the media to describe the effects of certain synthetic drugs. These drugs can be very dangerous and potentially lethal, and individuals who use them may experience serious health consequences. It is important for individuals to avoid using these drugs and to seek help if they or someone they know is struggling with addiction. Doctors are perplexed by a new street medication that is being sold on the streets of Philadelphia, the epicenter of America's opioid crisis. Public health professionals are concerned about its spread and alarmed by the terrible injuries it leaves on users' bodies. The catastrophic effects of xylazine, sometimes known as tranq, are wreaking havoc in major US cities. The zombie drug can actually cause the user's skin to deteriorate. Fentanyl, an opiate that has ravaged America's youth, and xylazine are combined to create tranq. It may be purchased for only a few bucks per bag on the street. Dealers are aware that adding fentanyl lengthens the hit. In addition to putting users into a semi-conscious condition, the substance literally causes skin to decay. Scar, a scaly crust of dead tissue formed by open wounds, might necessitate amputation if left untreated. The sedative xylazine is used on horses and cows. With repeated exposure, it can result in sedative-like symptoms such as excessive tiredness and respiratory depression, as well as open wounds that can quickly get severe. If left untreated, the crusty ulcerations, which can develop into dead skin called scar, may require amputation. Tranq is basically zombifying people's bodies. Until 9 months ago, I never had wounds. Now, there are holes in my legs and feet, a 28-year-old young man named Sam told Sky News. With greater doses, xylazine completely renders users unconscious since it works as a tranquilizer. In contrast to opioids' semi-awake bliss, fentanyl cut with xylazine may cause users to pass out and reawaken many hours later. Anybody using drugs in this way is considerably more likely to suffer injury, such as sexual assault or getting hit by a car. The use of zombie drugs or synthetic cathinones can be extremely dangerous and pose a number of risks to users. Some of the dangers associated with these drugs include physical health risks. Synthetic cathinones can cause a range of physical health problems, including elevated heart rate and blood pressure, hypothermia, dangerously high body temperature, dehydration, seizures, and even death in some cases. Mental health risks. These drugs can cause a range of mental health problems, including anxiety, paranoia, delusions, and hallucinations. In some cases, individuals may experience long-lasting or even permanent psychiatric problems. Violent behavior. Some users of synthetic cathinones may exhibit violent behavior, which can put both themselves and others at risk of harm. Addiction. Synthetic cathinones can be highly addictive, and individuals who use these drugs may develop a physical and psychological dependence on them. Unknown ingredients. Synthetic cathinones are often made in illegal labs, and the actual ingredients and potency of the drugs can vary widely. This makes it difficult for users to know exactly what they are consuming and can increase the risks associated with their use. Overall, the use of zombie drugs or synthetic cathinones is extremely risky and can have serious consequences for users. It is important for individuals to avoid using these drugs and to seek help if they or someone they know is struggling with addiction.